Most of the babies are expected to pass meconium by 24 hours. If they don't pass stools by 24 hours, try rectal stimulation either with the rectal thermometer or by a lubricated feeding tube. And if the baby doesn't pass, even with that, you may need to call a surgeon who may do a PR evaluation. Could be Hirschsprung's disease or similar. Again, urine is passed by 24 to 48 hours, and it's very important that the team gets into the habit of recording the baby's passing urine at the time of delivery. Many babies pee at the time of delivery, and if this is not recorded, you may be unnecessarily worried, because once a baby has passed urine in the first day or at the time of delivery, the pathway is clear. It's only the feeding that needs to be established. So we have to review the antenatal scan findings, and we ensure adequate feeding. And if the urine output is still delayed, we would need further intervention in these cases. Some posits are normal, and some babies have mucousy spit-ups on the first day, mostly related to irritation of the stomach with the gastric fluid, the liquor that they have swallowed. If there was meconium stained liquor, for example, it's more common. If it keeps persisting, we could consider a stomach wash with normal saline once. But if the vomiting persists, or if the vomit tends to be greenish, and especially if this is associated with failure to pass meconium and abdominal distension, intestinal obstruction is a serious possibility, and we need to do the abdomen X-ray and contact the surgeon as needed. A green vomit by itself could indicate serious conditions like malrotation or volvulus, as the green color is coming from the bile, indicating an obstruction beyond the second part of duodenum. So even if the baby is relatively normal looking, since these conditions can worsen very rapidly and we might lose a significant length of bowel if there is a delay in intervention with malrotation, for example with volvulus, we should be contacting the surgeon as quickly as possible. The normal stool pattern in babies is very variable, and in the babies in the first 3-4 days, as the feed is starting to get established, a physiologic lactose intolerance may start, and the baby may have a frequent stooling pattern which is a little watery. But these babies are otherwise well looking, and they tend to feed well, they tend to pass urine well, and the weight gain has started establishing by this stage. So unless a baby looks sick, you don't need to label it as diarrhea. But if it's an explosive watery stool and there is a history of gastroenteritis in the family, the baby looks unwell, or there is fever or other concerns, you have to think of sepsis as an underlying cause, and we have to treat these babies very carefully as if they are septic, and hydration needs to be maintained carefully as well.